Hello, people. Bonjour. Ekaro, Ekasan. Good afternoon. Welcome to another lovely episode of Labor Room. And you're with me, your lovely host, Dr. O. Yes, I always say I'm lovely because I'm lovely. Yes. Whether I like it or not, I'm lovely. At least I always tell you stuff about pregnancy that you may or may not have ever heard about. Either way, you're learning something. By the way, if you would like to hear a particular topic discussed, feel free to comment in the box below. Tell us what you want us to discuss. If you'd like to see a particular guest on the show, if you have any questions, let us know. We would love to hear from our listeners. Okay, back to the business of today. Let me see, what should I tell you guys about today? Okay, I remember that some few weeks back, I said I was going to elaborate further on a particular topic, which most pregnant women would like to know more about. So I think that's what I'm going to pick today. And what topic is that? We're talking about vaginal discharge in pregnancy. Yes, vaginal discharge. Every pregnant woman experiences vaginal discharge throughout the pregnancy at one point or the other. So when should you be worried about your vaginal discharge? I mean, we know it's something that every pregnant woman should experience. We know it's something that even women that are not pregnant, at certain points in their menstrual cycle, they also experience it. But when should you be worried about the vaginal discharge you're having? These and many more questions are going to be answered on this podcast today. So let's see. Usually, the vaginal discharge in pregnancy should be odorless. If at all it has any odor, very, very mild odor. Then it should look like a milky discharge. And usually the cause of vaginal discharge throughout pregnancies, the hormones, like I said, estrogen being produced and increased blood flow to the vaginal area. So it causes like an increase in discharge and all that. However, when you are getting towards labor, the nature of your discharge will change. It will become more watery and it will be like egg white or mucus. So you notice it becomes thin and all that, and it might have a blood tinge. Usually that might be a sign that you are going into labor. That's what we usually call show, passage of show. So you should also be aware to notice if you pass show before 37 weeks, then report it to your doctor immediately because that is preterm labor. So you are going into labor before time. So why should you be worried about your vaginal discharge? Number one, like I said, if there is a change in this discharge and it becomes more watery, like what I just described, it becomes watery, it becomes more mucousy, and then you notice there's a blood tinge in it, especially if you are not around 37 weeks. So if you're 37 weeks and above, fine, it might be a sign of labor. But if you're below 37 weeks, it might be a sign that you are going into preterm labor. So you're going into labor before time. Your baby is not yet mature enough to come out, but yet your body is trying to push the baby out, and we don't want that to happen. So it's best you report that to your doctor immediately. Another time when you should be worried about your vaginal discharge is if the discharge is accompanied by lower abdominal pain. So you're having discharge and you're having pain in your lower abdomen, constant persistent pain or pain that is coming and going. It might be a sign that you have an infection. Or if there's itchiness in your genital area accompanied by this discharge, or some sort of burning or redness of that genital area, your vulva area. When you have this discharge, it might be a sign that you have an infection, maybe candida infection, yeast infection. That can be a typical sign for it, and you want to get it treated on time. Another time that you should be worried about your vaginal discharge is if you notice that it becomes whitish or grayish and there's a fishy smell that comes with it, especially after sexual intercourse, after the discharge must have mixed with semen. This is a sign of a particular infection that we know as bacterial vaginosis. That fishy smell, horrible fishy smell with grey or white discharge. So you should report this to your doctor so you can be treated on time. Or if your discharge becomes yellow or green and is very foul smelling, can be a sign of a sexually transmitted infection. And you don't want to have that while you're pregnant. So you also need to report it to your doctor so that it's treated on time. So these are the few instances, of course there are many more, but these are the few instances that you should be worried about your vaginal discharge. So how can you prevent yourself from having infections, that can lead to vaginal discharge, abnormal vaginal discharge in pregnancy? Number one, you need to always wipe from front to back. I know I've said this in my podcast before when I talked about urinary tract infections, but it actually applies to both scenarios, both urinary tract infections and vaginal genital tract infections. Always wipe from front to back so that you don't transfer bacteria and microorganisms from the anus to the vagina or the urethra where urine comes out from. Always wipe from front to back. Always wear cotton underwear because it absorbs moisture more. Avoid nylon. Nylon does not absorb moisture, so it makes the area damp. It promotes the growth of yeast and fungi infections and all that. And trust me, you don't want that. Then another thing you should do is avoid douching. All this fresh, feminine wash, blah, blah, blah. I'm using certain things to wash inside of my vagina. Seriously, I don't know why you are washing or putting anything inside of your vagina in the first place. That place is self-cleansing. It does not need your help. You only need to use simple soap and water to wash the outer area of your vagina, the vulva area and all that. The inside area, you have no business touching it. Are you a gynecologist? Leave that to the gynecologist. By the time you start using all sorts of different different washes to wash that area, you are disturbing the balance of the normal bacteria that should be in that area, protecting the vagina. And when you do that, you expose yourself to the risk of having fungal infection. So this applies to both pregnant and non-pregnant women. Stop douching. Stop using all these chemical scrubs and chemical washes or whatever to wash the inside of your vagina. So those are ways that you can prevent vaginal infection. And that way is to avoid wearing tight pants, so that at least that area can breathe. Don't wear pants that are too tight so that you don't sweat too much and all that. That's basically it. So if you notice any of those symptoms I mentioned earlier, please report it to your doctor on time, and you can take any of the preventive measures I told you to prevent having infections. At least now we know when we should be worried about our vaginal discharge. Or don't we? Well, if you didn't hear anything I said, you can press the rewind button and listen to the podcast all over again. I'm sure you like to hear my lovely voice. But for those that heard, next week I will be back with exciting things to talk about. So enjoy your week, enjoy your weekend, and keep listening to the Labor Room.